My first guest is Stan Gerbrandt. He's a chiropractor in Fresno here, semi-retired a little bit, but we're going to talk about something we've never talked about on this show before, and that is the art or craft of chiropractic care. So, Stan, I'll just kind of let you run
an art,
with
definitely.
Run with it. Everybody has their preconceived notions. Some people go to see chiropractors and they really don't know what's being done. They just say, I feel better, so I just keep going back. So I'll just kind of let you run with the parameters of the business.
Okay, well, first of all, chiropractic is a non-invasive form of health care that relieves nerve pressure in your spine being the main communication between your body and your brain. Mm-hmm. So if your body is getting communications from your brain and vice versa, your body just works better, mm-hmm. and you're healthier.
Yeah. Now there are a lot of things that you can treat, and I'm sure there's things that you can't. People that have had like severe damage, or discs and other things like that. So we'll talk about the spine and then some of the other stuff. Mm-hmm. So what are some of the things that go haywire in the spinal column that you can help them with through non-invasive procedures?
Well, the main thing, the general thing that I treat is problems with motion of the spine, because your spine is what allows those nerves to communicate with your muscles so your body can move, right? Mm-hmm. So if those nerves are interfered with, your body can't move correctly. Mm-hmm. So we got to make sure that all those vertebrae have the right range of motion, and then there's interference to those nerves is at a minimum, and the muscles work properly, and you can move properly. Mm-hmm. You don't feel like you're stiff or stuck in a certain movement. So.
Okay, and a lot of that has to do with alignment. Is that correct?
Completely. The alignment of the spine is real important. Now, it's not just a matter so simple. People always say, "Oh, my back's out." Oh, my back went out. It's really a question of the muscles working properly and holding those vertebrae in the proper position so that they can move in their normal range of motion.
Okay. Then what about when we get across to the shoulders and stuff? I was telling you beforehand, I've been through a few things that I've had shoulder damage, and it was not, a lot of it just had to do with nothing was broken, but everything was just kind of pushed around.
Right. Yeah. The shoulders are real important. That's what your head sits on, as well as the pelvis. The pelvis is your foundation. For you to be able to walk around, mm-hmm. you have to have a stable pelvis that's somewhat level, so you can still walk and the muscles are working evenly, and then your shoulders hold the head up, mm-hmm. and the head is very important. Your eyes have to be somewhat horizontal so you can see straight. So.
Yeah, in some cases the head is important. Okay.
Yes, in all cases.
There are those that will question that on us hosts, but we're gonna digress and keep moving forward. So now, there's a lot of things. I've been, as a young man, I was to the chiropractor a couple times, and without mentioning names, the doc would be pulling around on my legs and doing this, that, and the other. And
it wasn't Dr. Schlichting, was it?
He was one of them, yes.
Yeah, I would think too.
So
when I was a kid.
Yeah, talk about some of the alignments and some of the procedures that you would do, manipulations to get one in the balance.
Yeah,
here.
Well, the origin of chiropractic back in Iowa. Dr. Palmer, D.D. Palmer, started it over 100 years ago, and his real emphasis was adjusting the top of the neck, C1, the atlas. That's the vertebrae that your head sits on. So getting back to, the head has to be right, has to be level for the brain to be working properly. Well, that atlas adjustment was kind of paramount to him, and a lot of chiropractors really emphasize that upper cervical adjustment being the most important, and if that's in alignment, then a lot of the other things kind of take care of themselves. So it's it's a lot of different ways of looking at it, but that's kind of the origin of chiropractic. If you really want to get back to way back when it started.
Okay. Then also too, if the atlas and the upper neck and shoulders isn't right, that causes numbness in the hands and
right, numbness, pain, dysfunction, weakness, a whole array of symptoms that are possible depending upon the degree of the pressure on the nerve.
Okay. In the normal course of business, do people, like with your patients, do they wait till they are absolutely crippled and they can't before they come see you, or what do you suggest?
That
in
is
lieu of
always
that?
you see somebody that's been through the mill and the rounds with all kinds of doctors and all kinds of medications, and then they want relief. Well, everybody wants relief, but sometimes there's damage there that's permanent. I mean, you can make them more comfortable and get the segments moving, but sometimes there's damage there that can't be reversed. So, of course, we refer them to a medical doctor and
Right.
for palliation.
Okay, yeah. Actually, I served on a jury earlier this year for 6 weeks on a personal injury case, and it was interesting, and it dealt a lot with the C1 and all that. So, if nothing else, through that whole process, I learned a lot about the neck and the bones and everything else.
Yeah, there's quite an array of different techniques, and there's all the way when we were in school. It was this way back. It was the straights and the mixers, the ones that wanted to just focus on just adjusting the spine, nothing else. And then there's the mixers who want to mix in nutrition and physical therapy and all kinds of things. That all those things help, but the real basis of it is making sure the spine is functioning properly.
Okay, and I hear a lot too. People will say, "Well, their back went out and they're just absolutely crippled and they can't hardly walk." And they said, "All I was doing was tying my shoes." So is that just a symptom or something that manifests because everything was already out of whack to begin with, or?
No, it could be they just bent over to tie their shoe and they could have herniated a disc. People herniate a disc where the disc is bulging and they make the wrong move. A sneeze can do it.
Really?
Yeah, I've had plenty of people that sneezed and their leg went numb and they couldn't walk. So if that's the case, if it's a herniated disc, you've got to first figure out that's what it is and know what it is and take the proper measures and not just get on them and start adjusting a lot, and it could make it worse. So
Sure.
you have to know
Okay.
what's going on from the beginning.
When you're working with a patient, say you have a patient that comes in, sees you on a regular basis, like every couple of months or whatever, just to kind of make sure everything is kind of for a little tune-up there. Are you able to tell, as a doctor of chiropractic, if something doesn't feel right or isn't responding right?
Yes, our protocols, how we treat, is all based on, like the technique I use is called the Thompson technique, and I use a drop table, and all of the tests I do are getting feedback from the body telling me what move to make, what needs to be adjusted, where the area of nerve interference is. And a lot of it is muscle testing, and then a lot of it is leg checking. You move a certain way, and you can see how the legs change in length compared to each other. And that kind of directs me on to the next step that I need to do to fix it.
Okay. Something I do remember, and somebody else had told me that over time they had one leg that was longer than the other.
Yeah.
So is that a pelvis issue, or?
Most leg length differences are physiological, meaning almost everybody has them.
Okay.
I've had people that are perfectly even and they're in horrible pain. They can't even hardly walk.
Okay.
So that a little bit up to maybe even maybe a little under an inch is normal. And that does. If you get over an inch and it's actually anatomically short, that's a different thing, and you've got to,
Right.
give them a lift on one side. That helps. But the physiological, where the body is just compensating for the muscles being tight on one side or another, and the one leg will pull up more than the other, and there are a lot of different reasons why that happens.
Okay, that's interesting. It's just like I have flat feet.
Yeah, that
Bad, and just duck feet. I mean,
Yeah,
they're
my
just
brother has
right
the
down
same
on,
thing.
and so when they put me into arch supports, my podiatrist told me, he says, it's going to make everything else feel better. He says, but it'll hurt. But it was amazing. I started to wear them, and the first 2 days my knees hurt.
Right.
And then after that, I had a little pain a little bit higher towards my hips. But then after it went away, that was just a matter of just because if you're not in balance,
Right.
everything starts to push and pull.
Yeah.
And
Well,
all
the
that.
arches with flat feet, you're just all that force of making a step is going right up through your leg. The arches that in your feet absorb shock, so that alone is going to help, absorb shock up through your back, and it's going to help how you feel.
Well,
Definitely.
excellent, and that's probably another reason why I'm not a runner. Also, in addition to my philosophy on physical exercise, goes like this: is God's only given me so many heartbeats in this life. Why speed them up? with that, thank you, Stan, for coming in.
Oh.
And we're going to be right back after these messages.